Good afternoon. It is a pleasure to have all of you join me here today. Some of you I just saw a little earlier today, and I said, you are going to love this. So let's get right into what you're going to love. My host is sharing their screen right now. Please raise your virtual hand if you're able to hear me and see my screen. All right. I don't see any hands going up, so I'm gonna wait for confirmation from my host that my audio is okay and I can see your screen. Okay, cool. I see hands going up. Let's move. All right, welcome to the Practice and Pregnancy Orientation. I am your host, Dr. Adams. I started Full Circle about 10 years ago, and we are growing and getting better and loving what we do every single day. First, a few housekeeping things. One, this is confidential. Nobody else knows you're on the line. I will get a list of who attended and who didn't, but no one else will see that list. So please feel free to ask me questions in real time. No one will know it's you, and there's no stupid questions anyway. So please participate. I'll have poll questions that are hidden throughout here that I'd like for you to answer so that I know that you're grasping the information and that you're still awake. And if you have to jump off at any point, don't worry. This will be recorded and it will be available on our YouTube channel for the duration of your pregnancy. So we're going to start off with a poll just to show you how it works. First, you're going to tell me who's on the line. How many first-time mamas do I have here, and how many veteran moms do I have? So when you answer the poll questions, it helps me with how I gear the conversation, just kind of knowing who my audience was. So I'll do something like that, and I'll say, poll is closing in 3, 2, 1, boom, the poll is closed. And today, the veteran mamas barely edge out the first-time moms. Okay, so the topics we are going to cover today will include the full circle experience, which includes where we deliver. We'll go through some office protocols, including how to reach us, what to expect at your pregnancy visits. I'm going to give you lots of prenatal resources. We will go in depth in exercise and nutrition a bit later on and close up with a COVID-19 update because it's still a thing. So, first, our practice philosophy. We are a collaborative midwifery model, meaning, first of all, based on the premise that pregnancy and birth are normal life processes, not diseases of which we must cure you. But it is a normal life process that can have some complications. In the traditional midwifery model, they take care of low risk women who have no problems. And if they develop any problems, they may have to transfer out of their care in order to access different acuities of care. In the collaborative model, though, it allows you to stay within the care of the midwife, but we have physician direction. We just finished our maternity review that we do twice a month and go through everyone on our pregnancy list and all of their problems and make clear plans so we're all in agreement of what is happening with your pregnancy. So, to that end, the majority of our vaginal deliveries are attended solely by our nurse midwives. Even if you're having a VBAC, you can still have a midwife delivery. If there's a complication with your labor, something that's outside of the scope of midwifery, they will call physician consults, which means they'll either call me, Dr. Merrow, Dr. Mooney, or they will, if it's something urgent, like it can't wait until morning, we need to address it. All of us live about 15 minutes with no traffic toward the hospital. I found out on Monday I'm 24 minutes with traffic. But if it is something emergent, meaning it cannot wait for one of us to come in from home, where we deliver has OB hospitalists, board certified OBGYNs who are in-house 24 hours a day and ready to take care of you within 5 minutes. So to put it in perspective, last year we did about almost 550 deliveries. Only 3 times did we need to use the hospitalist. And I will tell you the most common reason we need them is not that there is something wrong, but that there's something fast. We get there, you get there, and your baby's coming out before anybody has a chance to make it to the hospital. So please call us when you're headed to the hospital first so that we can know. So one of us can definitely try to be there to attend your delivery. We deliver at HCA Florida, which is over on University. It's less than 10 minutes from the office. When you come in for your visits, you'll see on the wall the papers that say when the stork tours are happening. So quarterly, they host kind of a baby shower. It's really cute with raffles and stuff. But you can tour the unit, meet the nurses, see where you're going to meet your little one or little ones. If none of the dates on there work for you, you can still call that same phone number in order to arrange a one-on-one tour. They do them daily, they do them in the evenings, like they will arrange them around your schedule. They do them on the weekends, so that you and your family can come and just become familiar with where you're going to go and the environment in which you're going to meet your little one. Great. Next. Our office is open Monday through Thursday from 9 a.m. to 1 p.m. We close for lunch from 1 to 2, and then we reopen at 2 p.m. and close at 5. So if you call during the lunch hour, the phone will roll over to our emergency on-call line. That is on purpose because if you're having a medical emergency between 1 and 2, we don't want it to roll to a voicemail. We want you to be able to access the provider. However, the provider is also the person who is on call in the hospital. So please do not leave administrative messages during lunchtime because she does not relay them back to the front desk staff. Just wait until 2 o'clock to talk to the front desk staff about whatever. But there is still emergency access between 1 and 2, and you have to leave a voicemail to get a call back from her. On Friday, we're open from 9 a.m. to 1 p.m. So if you are calling with an administrative matter at 12:54 on a Friday, you may get a response to that on Monday, or if it's a holiday weekend, on Tuesday when we reopen. We don't do walk-in appointments. Our goal is to see you as close as possible to your appointment time as we can. And if we promised you the 11 o'clock space and someone walks in at 10:58 and says, I need to be seen right now, well, that's not fair to you because you've rearranged your schedule in your life to be seen at 11 o'clock by us. And that's what we plan to do. So, the same way we respect your time for that, we ask that you respect the time of the other patients. We do sometimes have cancellations and openings in the schedule, so there is a limited number of same day appointments. If you're calling, say at 9 o'clock, and you have a problem and you need to be worked in during the day, if it is something that can wait, you have a rash that you want looked at, for example, we'll work you in some of the open slots. If it's something that cannot wait, so you call at 9 a.m. and you say, hey, I really want to be seen. I'm not sure about my baby's movements. We look at our schedule, the only thing open is at 3 o'clock. We do not want you to wait 6 hours to evaluate your baby's movements. So we may say, hey, you need to go to the hospital to be evaluated. There are no open spots. It's not us saying that we don't want to take care of you. It is us agreeing with you that what you have is an urgent matter, and urgent matters may require an urgent care setting. Chest pain, shortness of breath. There is not anything we'll be able to do at the office, and especially not 6 hours later. So we may definitely recommend that you go where the appropriate instruments, EKG, chest x-ray, that sort of thing, are available, like in urgent care or an ER. When you call, providers are not able to leave patient appointments to take phone calls. So if you're calling because you have a question, we do have a nurse who is available to answer patient questions. A lot of your questions are about kind of the same things over and over. Is this spotting okay? I'm having some pain in the lower part of my belly and may have a urinary tract infection. Our nurse is Tony, and she is familiar with a lot of those questions and can go ahead and answer them. If there's something outside of her scope or something with which she's not familiar, she knows how to get in touch with the on-call provider to get you an answer. You just have to give her some time to contact us and get back to you. When you call, you have to leave a message in order to receive a call back, and you do want to make sure you're leaving it with the right person. So again, if we are in your appointment and we promised you that time, I don't want to leave your appointment to go talk about someone else's problem because this is the time that you reserved with me to talk to me about your problems, and your problems are the most important between 11 o'clock and 11:20 on that day. Be sure you are leaving your messages with the right person, though. So if you are calling with a clinical matter or you have something about FMLA paperwork, Tony is our nurse, the one to whom I just referred, and she's the one to assist you with those things. Naisha is my OB. I think this slide, I don't know if you all are seeing it because I'm not, but it's Naisha is my OB coordinator. And some of you have already had contact with her. She's the one who sends out your blood work when you do your history visit with me. If at the end of pregnancy you need something scheduled, like a delivery or aversion or induction or a circumcision for your baby. Naisha does all of those things. If you need a referral to the high risk doctors, cardiologists, hematologists, whomever, all of those things go through our OB clinical coordinator. And then everyone on the call has met Renee, our benefits administrator, and she is the one to talk to about insurance. Everyone on the line will likely be pregnant around the new year. So if you are changing insurance in January, please, please, please run it by Renee so that she can take a look at what your benefits are going to be. If your employer is changing insurance plans, please also let us know so we can check new benefits because we have a better plan and we don't have to collect on a payment plan anymore. And we may need to refund you some of your money. So please let us know. Also, we don't want to surprise you if you have a worse plan and we need to collect ahead of time. You get surprised with a big bill that you weren't expecting. So be sure the messages are being left in the right place. If you leave a message about your mucus plug for my biller, it will absolutely freak him out and you will not get the response that you need. If you're calling after hours with questions, the emergency on-call provider is always somebody from our office. So there's always someone with the phone from our office. You just call the regular phone number, the regular main line to Full Circle, and follow the prompts to get to the on-call provider. This is who you call if you think you need to go to the hospital. So I think I'm in labor, I'm having some bleeding, especially if you're about to call fire rescue, please tell whoever is with you, if you don't have the presence of mind or ability to do it. If you're calling fire rescue, please have the person with you also call us and say, hey, we just called fire rescue and we're headed to the hospital. Please remember when you call the after hours line, you have to leave a voicemail for the phone to even register that you called for us to call you back. Otherwise, if you call and hang up and call and hang up and call and hang up, it won't even show that the call came through. And just follow those prompts and leave us a message and we'll call you back. Now, the message does say that if you don't get a response in 20 minutes, call back. If you don't have 20 minutes and you're going to the hospital, just go into the hospital. We will get the message. Because remember, the person with the phone is also the person in the hospital. So she may be in a delivery, but she will get that message when she comes out of the delivery. The patient portal is also a way to reach us, but do remember that response times can take up to 2 business days. So business days are Monday through Friday. So if you send a message on Thursday, you may not get a response until Friday, then Monday. So urgent things are not supposed to be sent over the patient portal. If it's a non-action item, like you're calling about or sending a message about natural calm, for example, can I take this supplement? It may be something that we pass on to the person who's going to see you at your next visit. And lastly, I'm sorry, guys, I have a lag here. The portal is best used for things like losing your lab slip. So if we printed out some labs for you at your last visit, you lost your lab slip. I understand I lose mine all the time. And you need another one because you really want to get these labs done. You don't want to just show up and hope that Quest has the electronic order. Just send us a message. We can have Naisha email another slip to you. No problem. Or say you have COVID and you need to cancel your appointment or convert it to a virtual. As long as there's 2 business days between what you need and the action item and your message, then the portal is an appropriate place to communicate that. Things you don't want to put on the portal. Urgent matters. So remember that Thursday to Monday gap, please do not send urgent matters like blood pressure concerns. If your blood pressure is through the roof, your head is throbbing because of it, you don't feel your baby move, you're having heavy bleeding, that's not something that should sit on the portal for multiple days. That is a call to the emergency on-call after hours line. We also ask that you don't send blitz messages. So if you sent one message, didn't get a response in an hour, don't cut and paste the same message to someone else and cut and paste it to someone else. That is portal abuse because sometimes we'll all answer them at the same time. You never know when we're going to get them. We don't get these as text messages on our phones. When we sit down to log in to the portal is when we see them. And so people have been very upset that they go to the pharmacy and find 5 prescriptions for one question and they want to know which one they should take. Well, 5 different people answered you and there are multiple antibiotics or whatever we could use to treat it. The other concern is that cut and pasting messages can appear that you are a bot trying to spam the system and you may get your portal account deleted. And we'll try to reinstate it, but it can sometimes take months. Please do not attempt to have an appointment via the portal. If you have questions that are open-ended, anything more than a yes or a no, text yourself those questions so that you'll have a list of them when you're ready for your appointment, or schedule an appointment because we are happy to come and see you. That people scan in articles and say, hey, can you take a look at this article and tell me what you think? No, I just saw patients for 8 hours in the office, did all my charts, reviewed my labs, reviewed the ultrasounds, did some administrative work, and now I want to see my kids. So we don't want to then come home and do 20 more visits, mini visits over the patient portal. So please try to limit the questions that you ask there, or schedule an appointment because we're happy to talk to you in real time about that. All right. Ultrasounds are also something that we use the portal for. So urgent findings are always discussed on the same day as your ultrasound visit. Otherwise, we have to have the sonographer complete her report, download it from her machine, upload it into our electronic medical record system, divide it amongst the providers, and then review it. So please give us 2 business days to receive your report, review it, and release it to the portal with commentary. Now, if you know that your anxiety is not going to let you wait 2 business days to see what is on that ultrasound report, please be sure that you're making an appointment. A return will be like a prenatal appointment on the same day as your ultrasound. That way, the sonographer can print off a preliminary report for the provider that you're seeing, and she can go over it with you, and then you'll get the final report on your portal in a couple of days. I know sometimes you'll see Taylor and Kathleen just typing away, and you're like, oh my gosh, let me run to my car and ask them, what do you see on the ultrasound? My answer is going to be, I really don't know yet, but I do know that it was not urgently abnormal because we would not let you leave the building if there is something urgently abnormal. That is the one time we will break in our schedule. Someone will come and talk to you, and we will not let you leave without a plan. So, you know who else has a portal? Quest. Quest has a portal through which they send the results to you before they send them to me, if they send them to me at all. And then you see these results and you see all this red and it freaks you out and you send messages, Dr. Adams, what about my red blood cell indices, which you've never thought about ever in your life, but suddenly Google has told you that this is the reason it's your last day on earth. Just want you to know, red on a report does not necessarily mean that it is abnormal because the reference ranges we use for pregnancy are different than non-pregnant. So on the Quest report, it'll show you what's normal for someone who's not pregnant. Pregnancy changes you physiologically, and there are some things that will show up in red that are actually okay because you're pregnant. So give us a chance to receive the reports from Quest because it closes our order loop. Please don't upload the results from your MyQuest portal to a portal message to us saying, see, look, it's my red blood cell. It's all right. Let us receive it from them, review it, and we'll release it with our commentary saying, hey, don't even worry about the ones that are red. Those are okay for pregnancy. Um, if you've had those results for over a week and you don't have them from us, then it'll definitely let us know. One of the most common reasons that we do not have your labs is because you used a different name when you were at the lab. Please use the same name every place you go. So when you go to consultant offices, when you go to the lab, you all are like CIA agents. Every time you go someplace else, you have a different name. So when things come into our office, they get sorted by demographics, name, date of birth, and that sort of thing into your chart. There is a whole bucket for couldn't find this patient. And a lot of times your labs are sitting there and we haven't had a chance to review them because we haven't matched them with your other identity. So alternate name use guarantees delays in us being able to review your labs and studies. And ideally, everything should match your insurance information too, because when we go to file claims, the insurance company is very quick to say, I don't know this woman. And then they don't pay for things, and then everybody's all upset because there's bills every place that aren't paid. So please choose a name and stick to it. Good job. Any questions on contacting us, appointment times, what your name is? All right, very good. Next, let's talk about what to expect at your prenatal visits. So, first thing to expect is that you're going to forget all your questions as soon as you hear the baby's heartbeat. So, text the questions to yourself, start a little pregnancy thread so that every time you come in, you can access that, and we can talk about all the things that you wanted to discuss in your agenda. We want you to wear loose, comfortable clothing so that we can access your belly, because we're going to listen to the baby's heartbeat at every single visit. We may not do an ultrasound if we can hear it with the Doppler. As long as we can hear the baby's heartbeat, we are reassured. If we have any trouble finding it, then we may do a quick bedside ultrasound to take a look at it. We want you to arrive a minimum of 5 minutes before your scheduled appointment so you'll have time to check in and handle any insurance or scheduling issues at the front desk. And if you need to leave a urine sample, then we want you to have time to do that. We are no longer routinely doing urine specimens on everyone. ACOG says we no longer need to do that, the American College of Obstetricians. So only if we're following you for elevated blood sugars and we're checking for glucose in your urine, or elevated blood pressures and we're looking for protein in your urine, or if you had a recent urinary tract infection and we need to do a test to make sure that you're cured. You'll know, front desk will know whether we need a urine sample. Otherwise, we also know you are pregnant, you've been driving, you've been drinking your water, you better be drinking your water, and come on in, use the restroom, and plenty of time to talk to your midwife about what's going on with your pregnancy. If you are 10 minutes late, we will still have time to check on you and your baby. That's typically like a blood pressure, fetal heart rate check, going over any blood work, or ordering new blood work, but it does leave little time for your questions. If you are 20 minutes late, you have missed the entire appointment slot. Again, as I said, sometimes there are openings later in the day, and they may be able to work you in a day in an hour or so, or 40 minutes, if that works for your schedule. If that doesn't work for your schedule, we can find another day or time that works for us mutually. Diagnostic ultrasound visits. So the question I get a lot is, when is my next ultrasound? That first one was so much fun. Well, that's how we draw you in. So good question though. Diagnostic ultrasounds are separate from prenatal visits. And the way to know whether you have one scheduled is to look in your portal and see, do you have more than one appointment time? And is there a provider's name associated with your visit? So Tina Test, my imaginary patient here, goes in and she clicks on appointments. And Tina sees that she has two appointments. One is scheduled at 9:20 with ultrasound, which is not a provider's name. That means she has an ultrasound. Then she has an appointment at 10 o'clock with Dr. Yeckel. Dr. Yeckel is a provider's name, but Dr. Yeckel does not do ultrasounds. So Tina can tell her family, hey, you want to see an ultrasound? Come with me at 9:20. We'll take a look at the baby. If you'd like, we'll hang around and see Dr. Yeckel a little later on to find out if there's anything about the ultrasound that I need to know. And then Tina's all set. Again, remember, results from those ultrasounds are otherwise sent to the portal within 2 business days, unless there is something urgently abnormal, in which case we will discuss them with you on the same day. So when you're checking out from an appointment and your midwife has said to you, hey, it's time to schedule an ultrasound for whatever reason, then please let the front desk know that you need to schedule an ultrasound as well as another prenatal visit. So you should be walking out if you need an ultrasound with 2 separate appointment times. All right. So if we are not looking at your baby as much as you want to look at your baby, we never look at your baby as much as you want to. We do your anatomy ultrasound at 20 weeks, and if all is well, we do not need to look again until you pass your due date. There are boutique ultrasounds, and these are cute little places around town that do fun ultrasounds. So I put a few on here for informational purposes. I tried to get one in different areas of the city. But we're not endorsing any one over the other. They're all great. They do sweet little 3D things, and they put the baby's heartbeat in a stuffed animal. It's super cute. And there's another one that I did not list on here. I know that it's relatively new down in St. Augustine. So just know that these places do exist. So our next poll question asks, when should you expect routine ultrasounds? And the key word here is routine, meaning you don't have any special circumstances like twins or what have you, and everything is going well with the pregnancy. All right, and I have a few people answering, and the polls are closing in 3, 2, 1, closed. All right, so at 20, 40, and 41 plus weeks, correct. So at 20 weeks was your anatomy ultrasound. If we don't see everything we need to see, you may have a follow-up, but that's not routine. Otherwise, we would not do it until after. We aren't doing them at every single visit. We are listening with the Doppler for a visit. All right, let's head over to our website. This is fullcirclejacks.com. And here you will see, let's see, we're going to start with, oh, my banner is gone. Can you scroll up a little bit, host, so we can see? Thank you. Um, this month, we will have been at HCA Florida for a year. It's been a really good year. Those of you who delivered with us before at Ascension and have questions about why we delivered, if you missed my town hall last year, you still have access to watch the replay there to take a look at why we moved. But at this point, I think if you're on any social media, you know it's been an amazing move and no one's really questioning it anymore. All right, so providers, we'll start down here with one of these lovely ladies having the opportunity to help you welcome your little one or little ones into the world. So there's me with more hair. There's Dr. Marrow. She's got the same amount of hair now. Dr. Yeckel and Dr. Mooney. Then we have the midwives. There is midwife Lauren, midwife Krista, midwife Cindy, midwife Dawn, midwife Missy, and midwife Jane. And for those who have planned belly births, we will be adding PA Vanessa to the list very soon, who's going to be assisting and scrubbing in on our belly births. We'll talk about that later. All right, you can click on any of our bios to learn more about us. So you didn't have to show that, but we're going to head over now to the patient information and click the obstetrics tab. You'll know you're in the right place because you'll see all the bellies all the way through and the baby there at the end. So our delivery stats, which many of you are with us because of our stats, attempting for a vaginal birth after cesarean or just trying to avoid a first C-section. So our stats are here back to 2018. Some years are better than others, but we are always transparent with our numbers. All right, next we have our prenatal care timeline. So we're going to click on that so you'll know what to expect at each visit. So everyone on this call has already had their confirmation ultrasound. We do those between 8 and 10 weeks, where we do the ultrasound that tells us where our preference is to do it between 8 and 10 weeks. It depends on when we're able to get you scheduled, but we set your due date at that point. You watch that video with me, with Renee, you go over your insurance stuff. And then they have two other appointments booked for you. The next one is your virtual visit. So the virtual visit is a history visit with me where I go over your medical history and your pregnancy history, if that applies. And we figure out, in addition to the routine standard labs, do you need additional blood work or consultations? So if you haven't had that visit with me, then your labs have not been ordered yet. Don't worry, this is happening soon. So at that visit, we order your standard prenatal labs. So we also have lab transparency here. This is the standard panel: blood type, blood count, serologies, urine culture. This is the panel recommended by American College of Obstetricians. Some of you will opt in for genetic screening to find out whether you're a carrier for certain genetic illnesses or whether your baby's at risk for abnormal numbers of chromosomes. If you're doing that, that is done at or after 10 weeks. And we email you your lab slips to go and get that done and tell you where the appropriate lab is to have it done. At this point in the pregnancy, we're seeing you in person every 4 weeks. So the next visit they've already scheduled for you is your physical exam, which is roughly 4 weeks after your confirmation visit in the office. At the physical exam, cervical cultures are part of the American College panel. The Pap test is not necessarily. If you are due for a Pap, though, you do have the option of having it done there at the physical exam, but it's not required as part of the panel. If you have a high-risk issue, we make sure a consultation to see the high-risk docs is in at this time, because they will typically see you somewhere between 12 and 14 weeks. So the next 4 weeks, you come back and you have a second trimester visit. We start talking about your belly changes and body changes in second trimester. That's when your belly starts poking out a little bit. You stop feeling so nauseous and tired, and you really start enjoying being pregnant. Then around 20 weeks, as we discussed, is when your anatomy ultrasound is. And if you're meeting with a midwife on the same day or around there, we start talking about childbirth education classes and breastfeeding classes. Most of those courses are about 8 weeks long, so we figure it'll take you about a month to find one. You get started on them in early third trimester, so you'll have plenty of time to complete it before you deliver. In the middle column there, you'll see we also do a mental health screen around ultrasound day. So when you do the mental health screen, this is not like we're not singling anybody out. This is across the board. Everybody gets this because pregnancy is full of ups and downs, emotionally and physically. And we want to be sure that we are getting ahead of some of these things, identify people who are at early risk for postpartum anxiety, postpartum depression, and being sure that we get those resources in place before baby arrives. 4 weeks later, we're looking at glucose testing. And I know we'll have questions about glucose testing, so just hold on. I'm going to go back and talk about that in a moment. For my moms who have a blood type that is anything negative, O negative, A negative, B negative, we're looking to secure RhoGAM, a special injection to give you around 28 to 30 weeks. This is also when we'll start giving you the information to pre-register at the hospital. For those who were with us at Ascension before and we used to hand out paper packets, guess what? It's now online. It's 2024. So, yes, you can do all of your registration stuff online. If you're planning on working with a doula, this is when you want to get her locked in at the beginning of your third trimester because now we're starting to get into our more rapid visits and a lot more questions about what happens during your actual labor. So, after this point, we're seeing you every 2 weeks in the office. So you will see here in the middle the option to repeat or decline their standard prenatal labs. So we have ACOG recommendations and then we have Duval County Health Department recommendations too. As you can imagine, there are different patient populations, risk stratifications throughout the county. So if you do not feel that you are a high-risk person to contract an STD during pregnancy, then we do have a form that is available to opt out of repeat screening for STIs. This is also around the time we recommend getting your vaccinations, your pregnancy vaccinations. We do not do them here in the office. This will be something that you would go back to your primary or go to a minute clinic to have. So Tdap, RSV, flu, COVID, this is a time when you'll have enough time to make antibodies to pass to your baby during breastfeeding. First time mamas, you want to select a pediatrician. If my veteran moms, decide if you're staying with your same pediatrician, and then you start your every 2 week appointments. If we have some pregnancy complications like high blood pressures or high blood sugars, we may start doing some fetal testing at 32 to 36 weeks. For my moms who already know for whatever reason that they are having a belly birth, which is our term for the C-section, we try to get that date for you scheduled around 32 to 33 weeks so that you can start planning for yourself. At 36 weeks, we do another pelvic exam, your group beta strep. And the group beta strep, we'll discuss why that's important and what it is when we do that. But if you've already opted out of repeat STD screening, then you can also opt out of repeating your cervical cultures at that time. After this visit, we're in the home stretch. You start your weekly appointments. This is when you're full term. So go ahead and bring that birth plan in because now all things are on the table. Start your natural cervical ripening methods. For my moms who are having your belly birth, our standard time is 39 weeks. Sometimes there are certain circumstances like prior fibroid removal that requires it to be a bit earlier. But then my moms who are waiting for baby to give the signal for labor, be patient, be patient. It will happen. And we want everybody out by 42 weeks. So for first-time moms, 41 weeks and 5 days is when we recommend an induction. For my veteran moms, 41 weeks and 6 days because your labor tends to be shorter. All right, remember this is on the website, so you can print it out, put it on the refrigerator. First-time moms, just know the average length of labor for you is about 24 hours. 24 hours. So don't worry if it's been 12 hours and you feel like it's been forever. You're about halfway there. And second time moms, it is usually about half the length of whatever your first labor was. Question I have here, if I started with the practice further along, will I have more condensed visits to catch up? No, you'll still be on the same visit schedule. Unless you have any complications that require additional visits, we still keep you on the same schedules because we still have the same things to say at the time of pregnancy. Let's talk medicine. So if you have a headache in pregnancy, what are you more likely to do? Are you more likely to just take some nice deep breaths and meditate? Will you take a Tylenol or would you go to the emergency room? Because I've never had a headache before, Dr. Evans. Polls are closing in 3, 2, 1, closed. All right, today we have more medicators than meditators. Until we have more veteran moms. Those kids drove you to Tylenol, didn't they, huh? All right. Some of you have already said to me, Oh, I've had this problem, but I can't take anything because I'm pregnant. False. We don't want you to suffer. So there are relief measures that you can try first. And then if that's not working, then there are some things that are safe to take in pregnancy. So we have here listed in alphabetical order common discomforts and symptoms in pregnancy. On the left, in the middle are the relief measures we'd like for you to try first. These are the non-medicinal things that we want you to try. If you send us a message saying, "Oh my gosh, Dr. Adams, I am so constipated. What in the world can I do?" Well, the first thing I'm going to ask is, now, have you tried everything on the website for that? Some of y'all have gotten smart and you'll send me a message saying, "Oh, okay, Dr. A, I've tried everything on the website and none of it is working. Now what do I do?" By all means, if you have tried everything out here or you have questions about the things on here, definitely let us know. But we do want you to try to exhaust everything on here first. There are some caveats with that now. If you're nauseous and vomiting, unable to keep down fluids for 24 hours, please do not keep trying ginger for 2 days. You will dehydrate and harm yourself and your baby. But otherwise, we do want you to try the things on here to see whether or not we can get away with not doing prescription medications. But sometimes these things just aren't enough, and that's what we're here for. So just remember that this is out there as well. And again, you can print it out, you can stick it on the fridge because when do these things bother you the most? At 2 in the morning? Absolutely. So be sure that you take a look at our safe medications and pregnancy list. We're headed back to the website. And the next box is gestational diabetes screening. Remember, I said I was going to talk about this later. This is not later. I'm still going to talk about that a little bit later. But remember that this box is out here because I am going to refer back to it. Weight gain in pregnancy. Some of you are very concerned that you have not gained any weight and you're already through your first trimester. Some of you are very concerned that you've already gained a lot of weight and you're only in your first trimester. So, how much weight should you be gaining? The answer is it depends. It depends on where you start. So, there's a link down here at the bottom, you can click on it when you put in your height and weight pre-pregnancy. Then it will tell you what the recommended weight gain is based on your current body or your pre-pregnancy body mass index. And what you'll see in that last column is the rates of weight gain are measured in your second and third trimester per week. So that's really when we start counting it. So first trimester, everybody's nauseated, nothing tastes good, all these food aversions and everything, can't keep anything down. It's okay. Your baby is an adorable little parasite who is going to take the best of what you have to offer. You're going to feel terrible, but your baby's going to be growing just fine. Second and third trimester, when you start to feel better, both of you will get the nourishment you need. So prenatal vitamins or something of that sort are really more for you than they are for baby in the beginning because baby's just going to suck out all of your vitamins. And then you just need some to replace to keep yourself healthy. All right, we'll go back to the website and discuss birth preferences. Oh, cool. Yes, let's click on this one for sure. So birth preferences, especially for my first time moms, you've never done this before. And so you may have some anxiety about what's going to happen in the hospital. So planning some things out, writing some things down can help you with some of that anxiety, just kind of knowing a good direction for yourself before you get there. And there's lots of information on here. Everything from how you want labor to start to what you want to wear in labor, how you want to be monitored, what you want to do in terms of pain relief. I will put out there, I'm still not sure about nitrous. We are in some red tape bureaucratic holes with regard to the nitrous right now. So you can check it, but depending on when you deliver, I'm not certain when it will be available. But we will keep you posted on that for sure. Other things I want to point out, moving around, hydrating orally, eating, we don't starve you and strap you to the bed. You can labor in any position, push in any position, deliver in any position, that's fine with us. Our standard is perineal massage to try to prevent tearing by stretching. We want to delay cord clamping. It's totally up to you and your plans on how long you want it to happen. If you need to collect cord blood for stem cell, let us know because we don't want to delay it until it stops pulsating because you want to get some in your bag. Immediate skin to skin, early latching, all that good stuff on here. You guys can read. So it may seem like a lot of information, a lot of choices. choices, but there are 21 boxes on here and not every box is going to apply to you. So I recommend taking one box per week. If you have 20 weeks left in your pregnancy or 20 weeks left until your due date, your 40-week mark, and take your time. Nothing on here is dangerous. These are all matters of preference or opinion. And then after your 36-week visit, bring it in. Talk to the midwives. You always have the opportunity to ask, hey, is this necessary for, or why is this necessary? Or does this even apply to me? Or what's the purpose of this? That is what we are there for, to discuss what's on your birth plan. And those of you who have doulas, your doula can help you with the birth plan and figure out what's salient to you. Cervical ripening techniques. So you saw on what happens at each week, you start your cervical ripening techniques. Really, you hit them hard after 36 weeks, but there are things you can start as early as 20 weeks, like raspberry leaf tea to help tone the uterus, which makes your contractions more effective, which, as you can imagine, probably shortens your labor if your baby's in the right position. But 36 weeks is where you see things like evening primrose, acupuncture and acupressure, breast pump, clary sage. Again, you guys can read. What you won't see on there is castor oil. And you can definitely ask the midwives why they do not have castor oil on the list there. And I'm sure they'd be very happy to give you the answer to that. So at some point, you're going to want this little one to come out. So remember, the cervical ripening techniques are right here. You do not have to go to the internet to look for them. First-time moms, listen up. And then I also would like to know whether I have any veteran moms who had a previous C-section and are planning for a vaginal delivery this time. Because, okay, cool. All right. We're not alone. All right. Polls are closed in 3, 2, 1. Very good. Thank you. So we do have a couple of VBAC mamas on here. So listen up. This is for you. And then we have first-time mamas. You guys are actually doing the same thing, trying to avoid a cesarean that you really don't need. Now, my VBAC mamas know babies are gonna baby. You can't control some parts of it, but control what you can. So if you have some anxiety about your last delivery, doing a fear release about your last birth experience is very important. For everyone else, everything else on this list, Webster certified chiropractor, pregnancy yoga, do your method classes, do your squats. Somebody is on here today, and I know she's been doing her squats because we talked about it just earlier this week, and I'm so proud of you. Only gain the recommended amount of weight during pregnancy. You do decrease your chances at a vaginal delivery with excessive weight gain in pregnancy. Babies get stuck in weird positions when they have enough space to do it. Get an experienced doula. This is not the time to cheap out on doula care. Spinning babies to find exercises for baby's position, which we're going to talk about in a little bit. And then at the bottom, you'll see there, trust your body and your providers. Our goal is not to push you into interventions that increase your risk for C-sections. My stats are really, really good, and I do not want you to mess them up. So please trust us. We have been managing thousands and thousands of deliveries, and the way that we manage them has been successful. So please trust us that we are trying to help maintain your autonomy and also get you to your goal of the delivery that you're looking to have. All right, next, I believe out there is on the website, circumcision. If you have a little guy and you'd like to have him circumcised, we do that in the office after you're discharged before he is 10 days old. So the way it usually works is right after delivery, we'll ask, hey, did you plan to have him circumcised? If the answer is yes, you will look out for a message from our OB coordinator, Naisha, and she will send a message back asking, verifying his insurance, and then she'll give you his little appointment time, his first appointment date and time. So our goal is to do those before they are 10 days of age. If you have some religious preferences for the 8th day, for example, please let us know so that we can accommodate those as well. All right, this is all on fullcirclejacks.com. Please remember that this is out there and you can access it at any time for the rest of your pregnancy and beyond. Tell your friends. All right, so I guess you can tell by this picture here that the next thing we're going to talk about is nutrition. So those of you who are very concerned that you gain so much weight and all I'm drinking is coffee, Dr. Adams, it's wild. Is it coffee though? Or is it this salted caramel mocha monstrosity with all the sugar? Did you know that pregnancy only requires an additional 300 calories per day? That's it. And it takes 10 kilocalories to maintain a pound. And the amount of weight that you gain is based on your starting body mass index for pregnancy. So if you're starting the pregnancy at 170 pounds, it takes 1,700 calories to maintain that. If your goal weight gain is 25 pounds, that's 250 additional calories for a total of 1950. Divide that between breakfast, lunch, and dinner, and we have 650 calories per meal. Now, if you eat your 650, you can't then wash it down with a 570 mocha monstrosity. So just pay attention to your caloric intake and the things that you want to be looking to eat should pop up. So your proteins, your carbohydrates, this slide kind of gives you a breakdown of what you should be looking at, but really I want you to look at the one on the right. Simple changes can make a big difference. So just looking at the amount of sodium in traditional spaghetti sauce versus herb-infused marinara. I mean, it doesn't taste exactly the same, but to lose 500 milligrams of salt, it might be worth it to just make the conversion at least during pregnancy to reduce some of the risk associated with that. Okay, so having said all of that, the things you want to eat, lots of fruits, veggies, whole grain, cereal. You're not going to give your baby allergies to nuts or dairy by eating those things, so enjoy. For my coffee drinkers, you want to keep your caffeine at less than 200 milligrams daily. Also remembering that caffeine is a diuretic. So you want to use the 3-to-1 rule. Drink 3 times as much water as you are caffeinated beverage so that we don't dehydrate from that. Herbal teas are fine. These are our favorites in pregnancy: raspberry leaf, ginger, lemon, and peppermint. Protein for my workout people, my exercise, my bodybuilding folks, 70 grams per day. I know there are some pregnancy diets that tell you to cram in 120 grams of protein. Please don't do that. You will grow a 10-pound baby. And while people can have 10-pound babies, I bet if you ask any of them, they would have rather had an 8-pound baby. Deli meat is fine as well. Just be sure you microwave it for 30 seconds to get rid of any harmful bacteria. It does not have to be piping hot, fresh out of the microwave. Don't burn your mouth, but make sure that 30 seconds of microwaving has occurred. Soft cheeses that are made with pasteurized milk are okay. So if you are buying them from Trader Joe's or, Whole Foods or whatever, just flip it over. If it says pasteurized milk, then you're fine. If you can't tell, like you're at a restaurant, then maybe we skip the brie for the evening. No blue cheese for that night. Canned tuna, you can have 3 of those 4-ounce cans per week, which to me seems like an adequate amount of tuna, but I don't know your life. Maybe you need more tuna. If you need more fish, the FDA has a really nice document here. It says October 2021, but I promise that is the latest iteration of this. With the fish that you should eat in large quantities because of high levels of omega-3 acids, the ones that you should avoid because of high methylmercury, and those you should eat sparingly because they're just in the middle and not much use or not harmful. So that is out there as well. Things you want to avoid are undercooked meats and fish. So if you are a foodie like me and you like your ahi tuna and your medium rare steaks, I'm sorry, you will have to ruin your food for the next 6 to 8 months. I apologize. And have everything well done. For my kombucha drinkers, my kimchi eaters, remember those can be fermented, and your body may treat them in the sense of fermentation as alcohol. And so you want to limit, if not eliminate those. You want to eliminate alcohol because we don't know, honestly, how much is safe in pregnancy. And better safe than sorry. Also, you'd like to limit your sodium to 1,500 milligrams per day. And you remember that tag back there on the spaghetti sauce, 550 milligrams of sodium in that serving. You get 1,500 for the whole day. Because when you send me that portal message, Dr. Adams, none of my rings fit anymore. The first thing I'm going to ask you is, what did you eat last night? Soy sauce. All right, any questions on nutrition before we move on to exercise? I know I have a bunch of people who do exercise here, so maybe this is when y'all gonna ask me the questions. Okay, it is just fine to continue your pre-pregnancy activity unless your pre-pregnancy activity was doing nothing, surfing Netflix. You can start a new regimen because in second trimester, physiologic changes will accommodate more activity. Everybody's tired and weak and short of breath in their first trimester. That's okay. Just listen to your body and you will gradually get that energy back as your blood volume increases and your red blood cells increase so you get more oxygen to do more of that aerobic activity. If you weren't doing anything before, next slide. You can start a new regimen because a sedentary lifestyle leads to malpositioned babies, leads to C-section. The most common reason that I do C-sections is not actually even baby is too big or baby is in distress. It is baby's head is crooked. Descending into the canal sunny side up. So babies are supposed to come down with their faces down and their heads tucked. They come down with their faces up, looking at the world. And while it's a very optimistic view of things, it is the most difficult way to exit the pelvis. Only 5% of women can deliver their first baby sunny side up. But most women, these days at least, by the time you all get to labor, all these babies are malpositioned. So move, 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 get that baby to rotate. Those of you with these cute little Fitbit watches who are adding to your anxiety by constantly monitoring your heart rate, you will notice that your resting heart rate will rise 10 to 20 beats per minute. That is normal, that is physiologic, that is supposed to happen in pregnancy. If it is not making you dizzy, you're not passing out or anything of that nature, it is fine. It's okay. It's just a number. For those of you who are saying, oh, I'm already exercising, this is so good. I walk every day. Is it like work walking, like from your desk to the file cabinet? Because that's not exercise. So for walking to be considered exercise, you want your heart rate in the aerobic zone, which is 70% of your max heart rate. Your max heart rate is 220 minus your age. So if you're 30 years old, you start with 220, subtract 30 to get 190, which means you should not be exercising at heart rates above 190 for prolonged periods of time. 70% of 190 is 133, which is the aerobic zone. So your goal is to exercise with your heart rate between 133 and 190, sustained for 30 minutes, 3 times per week. Then your walking is exercise. Otherwise, your walking is transportation, which is also good, but it does not count. What exercises you want to do? If you like cardio, go for it. Treadmill, yes. Elliptical, absolutely. Running, sure. Swimming, that's my favorite. Indoor bike, yes, definitely. If you're on Peloton, my leaderboard name is Off My Meds 8, and you follow me, I do follow back, and we can exercise and keep each other honest. If you were lifting weights, you can continue to lift the amount you were lifting at the beginning of your pregnancy. You do not need to increase your resistance as your baby and your body will do that for you throughout the pregnancy. If you are already squatting, awesome. Squats are my favorite too. You heard me say that 3 times now. You want to build up to a minimum of 50 squats per day, and they do not have to be all at the same time. If you are not an experienced squatter, at 20 weeks, you start out with 5 per day. 21 weeks, you give me 10 a day. 22 weeks, you give me 15 a day. This will get those hips open and long and lean. And speaking of that, my other favorite exercises for pregnancy are Pilates and yoga. And they should be completed with pregnancy modifications. Any experienced instructor will be able to tell you what those are. But you want to think of any exercise that opens the hips, opens the pelvis, lets that baby descend and rotate into the proper position. Position. All right, things you want to avoid. High intensity interval training after your first trimester. So it's not the interval, it's the intensity. You can do the low impact version of these classes if you're an Orange Theory person or what have you. Anything that has you lying flat on your back for extended periods of time, like excessive ab work, you can work your abs, but do side lying abs or standing abs. Hot yoga, unless you are a hot yoga instructor and are fully acclimated to that environment, you want to stay away from that because you will get dizzy and pass out. You also want to avoid Next slide. Scuba, because of change in barometric pressure, high altitude hiking. You can visit your family in Colorado. 8 to 10,000 feet is where we say we're good and safe, but you don't want to go hiking with them because of reduced oxygen at those altitudes. Contact sports, please do not take up kickboxing during this time. We've even had some pickleball injuries recently, so anything with a ball flying at your belly, maybe try to avoid that. Or running to chase a ball. Outdoor biking after 16 weeks isn't a no, but just do remember with this asterisk here, it is about your center of gravity because it does change at 16 weeks. And when you're trying to turn corners sharply, you may fall off the bike, which we don't want at all. All right, so now that we have talked about diet, we talked about exercise, you've asked me no questions about either one. Can you prevent gestational diabetes with exercise and diet? Can you prevent gestational diabetes with diet and exercise? And the polls are closing in 3, 2, 1, done. Ooh, oh, no, no. Okay. I thought we were evenly split. Somebody snuck a vote in there right at the last minute. All right. No, no, you cannot. My veteran mamas know this from me. You cannot prevent it. You can manage it with diet and exercise, but you cannot prevent it. And this is why we screen everyone for gestational diabetes. Did you know that the number one risk factor for gestational diabetes is being gestational? So having a placenta, this is hormones. So, you know how we blame our hormones for like everything else? Your placenta gives off hormones that tell your insulin not to do its job, make you insulin resistant. So, the job of insulin is literally to clear your bloodstream of extra glucose. So, if your placenta is telling your insulin, you don't have to do that, then you have extra glucose just wandering around in your bloodstream, and that is diabetes. Extra glucose in your bloodstream is diabetes, but you only have it because you have a placenta, because you're pregnant. So if you don't have a placenta, then I do not have to screen you for gestational diabetes. But if you have a placenta, and some of you have two placentas, then I absolutely need to screen you for gestational diabetes. For my moms who say, but I never eat any sugar at all, Dr. Adams, please don't avoid your good carbohydrates prior to the test. Eat your fruits, eat your whole grains and such, because then your body will not feel shocked by seeing the carbohydrates that we introduced. The questions that I get some workout questions. Okay. Can I use my lymphatic vibration plate during pregnancy? Any place except for your belly? Yes. I feel like my recovery isn't the same and working out while pregnancy is tricky. Thoughts? It kind of depends on how far along you are. The recovery does get better is if you're farther along. If you're still in first trimester, you really can't judge anything by that. You will get a little better, and you may just have to modify it during pregnancy, and that's okay. Yay, you are awake. Okay, you guys are out there. All right. If it is the actual drink for glucose testing that bothers you, don't worry. We have options. You can buy the Simply Pure drink here at the office. It is soy-free, it is dye-free, it is gluten-free, BBO-free, kosher, vegan. Like it's offensive to almost no one. So you can purchase that here. Just know that if you are doing one of the alternatives, Quest does not accept outside glucose sources. So we will have to send you to LabCorp or some other commercial lab. But just let us know and we can put that on your lab requisite and order it from a different lab. There are other patient-driven options on our website. So that little box that I said, we're not going to click on it. You'll click on it because you'll see links to the fresh test, glucoganics, glucose tablets. So there are lots of options to not have to drink the drink that they have at the commercial labs. See, we're looking out for you. We just want the answers, really. All right, preparing for birth, childbirth classes. So those of you who are looking for unmedicated deliveries or at least just delaying epidurals so that they don't increase your risk for cesarean, we do recommend method classes. So on here, you'll see different names for things for Bradley method, hypnobirthing, hypnobabies, Lamaze. Again, all of these are for informational purposes. I'm not endorsing any one over the other, but it's a good place to start. And you can just look up childbirth education in Jacksonville, and it is everywhere. All right, next, breastfeeding classes. We can connect you with La Leche League for breastfeeding classes, and there is a class that's actually being held at some points here at the office. So when you're in, you'll see the flyers at the front when you check in. Every new parent should know CPR. So there's a link here to the Red Cross for taking infant CPR. And even if you already know adult CPR, it's a good time to refresh on that and to also learn what the modifications are for little tiny ones. Chiropractic care, we highly encourage. Again, this helps with baby's position. Just be sure he, she, or they are Webster certified. And that is a special pregnancy certification to make sure that they are accommodating the adjustments, no pun intended, that occur with your body during pregnancy. All right, another poll question. How many of you guys are planning to work with a doula? If you are, please respond. Who's working with a doula? Polls are closing in 4, 3, 2, 1, done. Oh, I got the most responses on this one. I have it at all. But I do love that quite a few of you have already decided and you know that you are. And those who are unsure, I'm glad you asked. What is a doula? So, doulas are there for emotional and physical support, and that is before you deliver, during your labor, and even in the postpartum phase. So, they have techniques such as how to breathe, what positions to get into, how to relax during labor, and they help you set your goals prior to going in because it is a lot easier to set all of these goals before contractions start because the Mike Tyson quote, everybody's got a plan until they get punched in the face. And let me tell you, it is a lot easier to remember what your goals were for your pregnancy if you have everything written down and you have a clear-minded advocate next to you. Because a lot of times the plans change when you come in and it gets real. So doulas are there for you. Doulas also are not clinicians, so they're not giving you medical advice or providing medical care. They are helping you process your feelings about the recommendations from us, your medical team. So they're not writing prescriptions for you, and they're not delivering your baby unless you don't have time and you get to the hospital and you have your baby outside in the parking lot and your doula is out there with you. Please don't do that. As I said, please call us so that we can all get to the hospital and into a room and in a bed safely. Thank you. All right, next. If you're looking for a doula and you don't know who, please talk to the midwives. They have no shortage of opinions on who their favorite doulas are. And the best ones that we've seen, they may come to some prenatal visits with you. They help you go through your birth plan, and they will come to your house when labor starts, come with you to the hospital, and they stay with you until that baby is latched. Many of them will come and do a postpartum visit or two with you and help with breastfeeding and some of the emotional changes that happen after you bring baby home. We also recommend acupuncture, acupressure, and pregnancy massage. When you come out of the bathroom in the front of the office, you'll see a bunch of cards of people who we know provide those services in town because they tend to come by here and drop off their professional cards and contacts. All right. Many of your insurance companies will cover breast pumps at no charge to you. So when around the time that you're doing your anatomy ultrasound, we ask you to scan your the QR codes that are in the rooms. Please do not go and try to find your own company to get breast pumps. Trust me, we're not getting any kickbacks from this company. They just make it really, really easy. They will get your insurance information from you, contact your insurance, find out what pump is covered. They write the prescription, send it to us. All we have to do is sign it. You tell them which one you want that your insurance covers. They write the prescription and send it to us. We sign it and send it back. These other companies ask for proof of pregnancy and due dates and how many visits you've attended and what your favorite color was in third grade, just a bunch of stuff that just holds up the process. With this company, we found people get their pumps in about a month, plenty of time before baby arrives. So around 20 weeks is a good time to get the process started for getting your breast pump from your insurance company. If you need to take FMLA, if a spouse, support person, parent, whomever needs to use family medical leave, we are partnered with Leave Guru. It's a third-party vendor, and most of the forms are completed in less than 24 hours. Those of you who have had forms completed in previous pregnancies know that it can take up to three weeks to get it done with back and forth before that, but Leave Guru has seemed to eliminate quite a bit of that. So when it's time to fill out those forms, please just get in touch with the front desk, and Tony, our nurse, will also help you to walk you through that process to get those forms completed. Postpartum care, because one day you won't be pregnant. If you had any issues with blood pressure, we'll see you afterward within a week of your discharge from the hospital. Incision check for my mommies who had belly births. Routine mental health screen. Baby blues are very common. About 80% of women will experience them. If it persists beyond 2 weeks, though, we may be looking at postpartum anxiety or postpartum depression, and so we'll want to screen for that. Postpartum doulas. If doulas are there for emotional and physical support, when do you need that more than right after you just had a baby? So look into booking a postpartum doula for help. The motherhood space is an amazing psych resource here in Jacksonville. We have it was a grant that Dr. Jill Garrett in the Baptist system was able to secure, and it is 4 or 5 days a week, 3 hours a day of maternal counseling, yoga, outside therapy, sessions with a group or individual with psychologists. And we can refer you, if you had postpartum anxiety or depression before, you can start with them before you deliver. And it includes free childcare there at the Y for any baby 6 weeks up to 12 years of age. And then pelvic floor therapy. We have a nurse who comes into the office 3 days a week, every week. And typically we want to start you at 8 weeks after delivery, no matter how you delivered. So if this was a vaginal delivery or a C-section, carrying a baby on your pelvic floor is still a risk for pelvic floor dysfunction. Pain during intercourse, leaking urine, all of those things we can address and make a lot better with routine pelvic floor therapy. So expect to start that 8 weeks after your baby is born. Okay, lastly, random frequently asked questions. This isn't last. Sleep on your left side, your right side, your back, all of those are fine. If it makes you dizzy when you sleep on your back, you can buy one of those wedge pillows from Amazon, put it under your hip, and then you won't sleep on your back and you'll feel better about that. You can help paint the nursery. Just be sure you're in a well-ventilated space and you're wearing your mask. You can take probiotics. You can dye your hair, including your eyebrows. You can do gel nails, but if you're sitting in a salon for a while with a lot of fumes, you may want to wear a mask so you don't get dizzy. You can travel in a car up to 37 weeks. You all are going to be pregnant over the holidays and visiting family. Be sure you're getting out and stretching your legs every 2 hours. You can use your skincare regimen, your benzoyl peroxide, your salicylic acid, but just nothing that has retinol in it. So bakuchiol, Bakuchiol, is a good alternative for that, which you'll find in some natural-based products. For air travel, my twin mamas, you can fly up to 32 weeks. My singleton mamas up to 36 weeks. If you need to fly beyond that for an emergency, you'll need to get a note from us, and we have pre-prepared notes for that as well. We also have pre-prepared notes for massage, doula, and dental care. If you're flying though, please, please, please be sure you are wearing compression hose, medium compression hose, and doing toe raises in the seats to keep your blood circulating, drinking lots of water, and getting up to go to the restroom frequently. Things you want to avoid. We're at the end of summer. Y'all are my winter crew, so I don't think you're going to be around roller coasters or water slides, but they are a no. Okay, now last for real. COVID-19 update regarding vaccinations. ACOG strongly recommends them based on studying 35,000 women in the New England Journal of Medicine article in 2021. Moderna and Pfizer are fine. We don't recommend Johnson & Johnson because it has an independent risk of blood clots, and so does pregnancy. The question that I have here is if I can repeat what skincare was okay and what was not. The only thing that is not is retinol. You can really use anything else, just not retinol. Great. If you are looking to get a booster, all the vaccines have been approved for a booster. So if you're 6 months past your Moderna or your Pfizer, it's fine to get your booster. If you're 2 months past your Johnson & Johnson, the booster is fine, but not with Johnson & Johnson. You can mix and match so you can get a booster with Moderna or Pfizer. There's no optimal time for this vaccine versus your flu, your RSV, or your Tdap because they all work a bit differently. So you can get them whenever, in whatever succession you plan to get them. Early third trimester, though, to create the antibodies for your baby is the best timing for these types of vaccines. And the type of mask, the question I have out here now is what type of mask you need to wear when painting. The N95 is always a good one because usually you're not, if it fits well, you're not able to smell or get any of those fumes in there anyway. If you do contract COVID, there are no formal recommendations for ivermectin, azithromycin, or Plaquenil, so we don't prescribe those. What we do recommend is vitamin C, vitamin D, and zinc in the doses that you see here. We also recommend a baby aspirin, 81 milligrams, for those who get COVID prior to 36 weeks. If you contract it after 36 weeks, we don't recommend taking the aspirin, and hopefully you're seeing the slide. We don't recommend taking the aspirin because we usually stop it at 36 weeks because of increased risk for bleeding at the time of delivery. We have seen increased gestational hypertension with a history of COVID. And so we do want to make sure that baby's still getting good blood perfusion. We do serial growth ultrasounds after your diagnosis, following your anatomy ultrasound. And we convert to virtual appointments if you're within the 10-day of onset of symptoms. For those of you who had babies in 2020 and 2021, take a deep breath. It's not like that anymore. We're back to our pre-COVID standards for visitation. In the rooms, you can have 4 visitors plus your doula. We don't require masking in the room or in the hospital or labor unless you are actively positive for COVID when you're in labor. And if you are positive, we are still not separating from your baby. We give you an isolette so that baby's not exposed to your respiratory droplets in the room, and we provide N95 masks, and because we do still encourage breastfeeding. And now that we've reached the end of this, we also say that a supportive course of action website for cold medications. Remember, I had sore throat on there and cough and cold and congestion. You really only need to go to the hospital if you're having difficulty breathing or if you can't break your fever with the normal amount of Tylenol in a 24-hour period. All right, last poll question. What can you find on my website? Can you find the birth plan? Can you find what to expect at each visit, safe medications in pregnancy? Or are you a star test taker and you read all the way to the end and you know everything out there is or can be found on the website? Fantastic. All right. You guys are kind of quiet throughout here. So if you have questions now, I'm still taking them. But please remember that we are social. So please find us on all the things. We are on Twitter, or it's now known as X. We're on Instagram, Facebook, and YouTube is where you'll be able to find this particular showing until the end of your pregnancy. All right, so if there are no questions, thank you so much for joining me. Again, remember, any part of this that you missed, you're able to go back out and take a look at on our YouTube. I appreciate you choosing Full Circle, and we are looking forward to helping you grow your bellies and grow your family. You guys take care.